What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, September 7th, 2024. If you're new to my channel, this is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, you may have clicked on this video because you tested positive for COVID, or you know someone who did, or you heard, maybe somewhere, not too many places talk about COVID, maybe you heard that, hey, we are still in a massive wave. It's true, we are. We're still doing between about 800,000 to somewhere as high as 900,000 cases a day, depending on who you look at for information, but the point is COVID cases are still high, and we got other viruses getting ready to enter the equation, such as flu, colds, RSV. Colds can happen at any time of the year as well, but COVID is also all year round. Flu, not so much. I mean, how many people can say they know someone that got the flu in the summertime? Yes, it can happen. Not as frequently as what's happening with COVID. You don't see 800,000 people a day getting flu in the summertime. It's just not happening. So I'm here to give you all the news that the media is not giving you about the ongoing COVID pandemic. So if you're new here, subscribe down below, give this a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Alrighty, we're going to take a look at a few news stories today. Then I thought it would be a good time for a little bit of a refresher on what the symptoms are of COVID, and it will talk about the isolation period for or how long it could be until you actually test positive as well. Plus, we're going to take a look at some of our data that we usually look at, and we're going to take a look at some state data as well, which I gotta tell you, the numbers are really bad when it comes to deaths. Yeah, surprisingly bad, actually, because here we are in 2024. I don't think many people expected to see deaths as high as they have come to. You'll see that in just a little bit. Starting off with this, we're not going to read you the full study here on video. You can read the full study. I already took a look at most of the study, and this is relatively interesting, but again, probably should not be a surprise. Offices, long-distance shared transport, some activities tied to COVID spread. Let's read the first paragraph. In the first 2 years or more of the COVID-19 pandemic, the risk of infection was higher in open space offices, long-distance trains, convenience stores, taxis, airplanes, and nightclubs, and during takeaway food deliveries. Carpooling with relatives and attending concerts suggest a case control study of various work, leisure, and other spaces in France, and much can be said for around the world. If you attend these crowded places, your risk of getting COVID is high, and there's a good chance that you could get COVID. And in this study, they do talk about the number of people that did catch COVID in these settings. Want to read the full study? I will post a link to it on my site in various different ways. The COVID archive, COVID study archive, and today's thread for the pandemic update with news stories that I'm sharing here on the video. We didn't do one yesterday, but we will try to get to one today. Alright, this is not good. Minnesota measles outbreaks now hits 40. Yep, the outbreak has now hit 40 cases, and in 5 countries, there are more polio cases being detected. That's not good. As we know, polio has also been detected in Gaza at this time, so that's something that is relatively concerning there. Moving on now to that, as promised, check at the symptoms of COVID-19, and it looks to me like they made a little change to this page since the last time we looked at it, which was, it's been quite some time. I don't remember the last time we went to this page, but they updated this on June 25th of 2024. And it says here, symptoms of COVID-19. Key points. People with COVID-19 have a wide range of symptoms, ranging from mild symptoms to severe illness. And I want to stress something that they're probably not going to tell you. COVID can be very random. Even a person that is perfectly healthy and normal can go on to get severe COVID. And it doesn't matter the age. It happens like that sometimes. At random, someone who's perfectly healthy can go on to severe COVID without much of a warning. Symptoms may appear 2 to 14 days after exposure to the virus. Symptoms may start as mild, and some people will progress to more severe symptoms. And as we all know, it could continue for some time, and some people do go on to get long COVID. Signs and symptoms. The following list does not include all possible symptoms. Symptoms may change with new COVID-19 variants and can vary depending on vaccination status. Possible symptoms include fever or chills, cough, shortness of breath or difficulty breathing, sore throat, congestion or runny nose, new loss of taste or smell, fatigue, muscle or body ache, headache, nausea, or vomiting, diarrhea. CDC says they will continue to update the list as we learn more about COVID-19. And of course, there's a lot of other symptoms. You could have brain fog while positive. And just know this. This is very important. If you go on to long COVID, that could widen even further to as many as 200 different symptoms. That's right. You could have 200 different symptoms. Now, they also tell you when to seek emergency help. Look for emergency warning signs for COVID-19, things like trouble breathing, persistent pain or pressure in the chest, new confusion. For example, if you're having a coughing fit that is so bad with COVID and you just can't catch your breath, maybe your skin starts to turn pale, gray, or blue, maybe your face turns red because you're coughing so much and you just can't breathe. Yeah, that's a good time to go to the emergency. There's many different cases. Maybe the fever gets so high you can't get it down. I've known people who have gone to the emergency department for that, and they are finding out other interesting symptoms. Some people, believe it or not, have blood on the urine. I've heard about that happening while positive for COVID, and they've had to go to the emergency room. There's a lot of different things, and please, if you don't have to drive yourself to the emergency room while positive, either get someone to do it, make sure you're all masked up, or just call 911. If it gets so significant, just call 911. All right, moving on. The UK this week did report a slight increase for cases. It was 1,486 cases. That's up by 4.4% or 63. Weekly deaths are down by 24%, 127. And healthcare. This was some good news. 2,695 people hospitalized, or admitted, I should say. That's still really high, but it was down by 455, or 14.4%. Heat-related illnesses. There's still a problem across the country. We're going to probably see a little increase again in the West Coast as things still continue to remain hot there. And plus, we do have the bad air qualities to go with that. We'll take a look at air qualities in just a moment. Taking a look at the pollen level map today. 23% of the country is in medium status. We do see reds in Tennessee, northwest Georgia, northern Alabama, northern Mississippi, northern Louisiana, a good chunk of Texas, almost all of Oklahoma, almost all of Arkansas, portions of Missouri, portions of Kansas, Colorado, Illinois, and even portions of Indiana are in the red today. So please take your allergy medicine if you live in those areas. Taking a look at what's going on with the air qualities right now, and the West Coast for air qualities continue to remain very bad, especially the Pacific Northwest, Oregon, Washington, Idaho, Montana, Wyoming, even portions of Nevada as well. Northern Nevada, you're dealing with problems. Look at this, down by Los Angeles, near San Bernardino, not doing too good right now either for air quality. So please be extremely careful in those areas. The Southeast just has a minor issue. The Northeast and the Great Lakes are not doing bad at this time. And Canada, Western Canada, does have problems as well. British Columbia, Alberta look to be really bad today. Want to learn more about climate and weather? You can do that over on my other X page at Climate Data Report. Taking a look at Philadelphia today. Look at this. 805 EMS calls were reported on Friday. Not a surprise because wastewater is starting to rise in the city, although we don't know what that's related to. Taking a live look in Montgomery County. Let me refresh this to make sure that this is up to date, and it is. Okay, just 5 calls right now in Montgomery County, Pennsylvania. That is a good thing. However, 2 of them are respiratory emergency. 1 is for stroke at this time. In Chester County, we do see here there are a few calls this time. A couple heart problems, falls, and a sick person at this time. Taking a look at Canada, the viral activity level for COVID is high. Flu A is low. And Flu B is not detected, and RSV is low at this time. All right, let's take a look at my notes for today. And it says, Saturday Pandemic Update Notes. And I do have something here that says funerals. What's that about? I got a question, plus an answer of my own. First off, the question. The question is, are you noticing an increase in funeral processions, or maybe funerals stationed outside of funeral homes, churches, whatnot? I am. I had to run to the grocery store this morning, and I did it relatively early. I wanted to beat the crowds, although there were hardly anyone in the grocery store this morning. I was quite surprised, but en route to the grocery store and en route back, I saw 3 separate funerals. One was at a church, one was at a funeral home, and one was at my local church. So I'm like, okay, yeah, 3 funerals just in that short period of time, which is the most I have seen in just a short period of time in quite some time. And prior to vacation, I was starting to notice more funeral processions as well. So, yeah, not good to see an increase in funerals. Let me know. Are you seeing more funerals? Alrighty, now for some data provided by CJS 83172, and some of this may catch you by surprise. No, these are not numbers from back in 2020, 2021, 2022, 2023. This is 2024, and some of these death numbers are really bad at this point, especially for a summer wave. Starting off with some Thursday leftovers, as he's calling it. Alaska had 10 CDC reported deaths in the month of August. Kentucky, 31 new CDC reported deaths. North Carolina, 52 new CDC reported deaths. Nebraska, 9 CDC reported deaths. Now it gets bad. Friday, Florida reported on Friday 1,368 new cases and another 97 new deaths in their daily update. Here's their weekly update. 10,282 new cases for the week, and yikes, 313 newly reported deaths for the week in Florida. New Jersey, in their daily report, had 625 new cases and 1 new death in their weekday update. And for the week, it was 4,560 cases and 14 deaths. New York, 2,222 new cases today, and for the week, 11,436 cases to go along with 72 new deaths. Virginia reported 1,518 new cases and 3 new deaths added to their open data page yesterday, and they had 7,666 cases and 44 deaths for the week. California, this is not good at all. 11,020 new positive tests and 150 new deaths this week, which included 31 from Los Angeles County, 33 new deaths in Connecticut this week, Illinois, 320 new CDC reported hospitalizations, and wow, 41 new deaths. Kansas, Missouri, Mississippi, Wisconsin, 18 new CDC reported deaths for each of those states. Yes, each one. So that's not good. Louisiana, finally under 2,000 emergency department visits for the first time in about 6 weeks, but they added another 16 deaths. Pennsylvania, my state. Oh, this is absolutely horrible. And we know Pennsylvania continues to worsen at this point because wastewater's been rising in my state. 625 new CDC reported hospitalizations, wow, and 65 new deaths. South Carolina, 28 new CDC reported deaths. Texas, 8,288 new cases this week with 55 new deaths. West Virginia added another 3,052 new positive tests and 10 new CDC reported deaths. So yes, deaths are starting to go up, and if I had to take a guess, I made a tweet about this earlier on Twitter, it is very likely deaths this week for the tally are going to be above 1,000, and I think we may even see deaths come above 1,200 this week, higher than what B&O News reported last week, because these deaths are absolutely horrible at this time. Taking a look at Walgreens, the positivity rate for COVID nationally is 32.2%. Moving on now to wastewater. We're going to do a full look at wastewater tomorrow, but I do want to point something out to you. Maybe you were paying attention really well on my update yesterday. You know, we showed this average map. It shows the average of wastewater sites in each state. We've been showing this map for several months now. Take a look here. Notice something different? Yeah, CDC changed the colors on this map to make them look less scary. Remember the old COVID transmission map? They did that as well. Yeah, classic CDC trying to downplay things. I don't even know why they have this like slightly shaded nonsense. This is just an absolute joke and a mess. We'll get more into that tomorrow. The latest variant of COVID is the KP.3.1.1 variant at 42.2%. As promised, we do have an update on epidemic status for COVID. And some mixed news here. Mostly more good than bad, but there are still some places growing. West Virginia is still growing. Then when we go up to Michigan, you're still growing. South Dakota is still growing. Idaho and Washington still growing. Likely growing in the state of Montana and the state of Utah. Now we are likely declining in the great state of Maine, New York State, Virginia, South Carolina, Mississippi, and in California. And it is declining, definitely declining, in the state of Texas, in the state of New Mexico, Louisiana, Alabama, Georgia, Florida, Illinois, Indiana, and also in Connecticut at this time, and everywhere else is stable, uncertain, or just not estimated. And there are several states that are not estimated at this time. So that is the update on epidemic status. Now let's quickly go through all states that report for emergency department visits. Nationally in the United States, it's dropping. Alabama, you are dropping at this time. Remember, these are people that show up at the emergency department diagnosed with COVID at this time. Alaska is dropping. Arizona is dropping. Arkansas, you're about to start dropping. California is definitely dropping. Colorado, Connecticut, Delaware, all dropping at this time. Washington, D.C., District of Columbia, you're starting to drop a little faster. Florida is dropping at this time. Georgia is really starting to drop at this time. That's good news. Guam is holding steady. Hawaii is dropping slightly. Idaho, you're still rising at this time. Illinois is dropping. Indiana is dropping. Iowa is dropping. Kansas, Kentucky, and Louisiana all now finally dropping. The state of Maine is starting to drop. Maryland, you started going up again, but now there are signs that you are starting to drop once again. Massachusetts is dropping at this time. Michigan, unfortunately, you are still rising at this time. Mississippi is dropping. Montana is dropping. Nebraska, some indicators you may be rising once again. Nevada was dropping, then it rose, now it leveled off. New Hampshire is dropping. New Jersey is dropping at this time. New Mexico, New York, North Carolina, North Dakota, all dropping. Ohio, you continue to rise at this time. Oregon is dropping. Pennsylvania, interesting one here. It looks like it was still rising, now it's trying to drop a little bit. I don't know if it's going to continue to drop. We've seen wastewater sites in many different portions of Pennsylvania start to rise once again, so we'll have to see what goes on with that. You would think that means more people test positive and more people show up positive for COVID at the emergency department, but only time will tell. Rhode Island is dropping at this time. South Carolina is dropping. South Dakota, you are dropping. Now you're just bouncing around. If anything, you bounced a little higher. Tennessee is dropping. Texas is dropping. Utah is still rising at this time. Vermont is starting to drop, but their cases this week that they reported were at highest of the wave, so that could go up once again. We'll just have to wait and see what happens there. Virginia has leveled off, and hopefully you will start dropping soon. Washington State, look at that, a reversal. You're starting to rise once again, and we do know your cases were slightly higher again this week. West Virginia is trying to peak, but we'll have to see what happens. Wisconsin is dropping at this time, and Wyoming is not reporting any data today. As noted yesterday, Washington, D.C., District of Columbia, is now at moderate levels for flu, and we do have low flu levels now in Georgia and portions of Alabama. Everywhere else is minimal at this time. New Jersey for today, this is where we will end off for today, 488 people in the hospital, 68 out of 70 hospitals reporting, 10 people on a ventilator, in the ICU, 46 people, and discharges, 86 of them at this time. Alrighty, folks, that does it for the Saturday edition of the Pandemic Update. We'll have another update again tomorrow. If you enjoyed this update, give it a thumbs up, hit that subscribe button down below, and of course, share these videos with anyone you know, and don't forget to hit that notification bell. Of course, leave your comments down below. I will see you all again next time. Until I see you next time, stay safe, everyone, and have a fantastic Saturday evening. Thanks for watching.